Hi, my name is Talon Ellithorpe. I'm the practice director here at Tustin Longevity Center, and I'm with Dr. Rita Ellithorpe, our medical director and founder. And we just wanted to take a few minutes today and explain to you some changes that are being made to our IV therapies for chelation only. So this is going to affect any chelation IV, including the enhanced chelation, the regular chelation, the challenge,
yeah,
of course. So doctor, you want to let us know what changes that we're making?
Essentially, the supplier for our calcium disodium EDTA has dried up, and they are looking at developing it or finding other sources.
Yeah, there's a temporary back order on the raw material.
Right. So that is not the only form of EDTA that we can use. There's disodium EDTA, and we do have that. So
Yes, we do.
what I've always done was use the calcium disodium EDTA, but the disodium EDTA is exactly the same thing. The only thing is, those of us who have practiced with EDTA chelation over the many decades, and the training as I teach EDTA chelation, is that when you use disodium EDTA, you have to give it a little bit more slowly.
Right.
Administer it just a little bit more slowly. So whereas a 60-minute enhanced chelation was fine with calcium disodium EDTA, the disodium EDTA needs to be the 90-minute infusion rate. And that really is the only change. I have used disodium EDTA many decades ago when I worked with Whitaker Wellness.
Right, it's been around for a long, long time. In fact, some clinicians across the country prefer disodium EDTA.
Disodium EDTA, yes.
And effectively, we just want to highlight that it is the exact same dose of the same drug, EDTA 1.5 grams.
Right.
We're just going to substitute disodium EDTA until we can get the calcium disodium EDTA back.
Right. And so it's just a time factor, which is not much, but it's a little slower administration. And that's the only thing. We have the wonderful enhanced chelation, where we add in all the things such as the extra vitamin C.
Right.
Regular chelation has all the wonderful things that enhanced chelation does, except for the vitamin C.
A little bit less vitamin C.
Yeah,
right.
A little bit less vitamin C. And it has the B vitamins, the methyl B,
the complex,
right?
the thiamine,
B12,
the pyridoxine.
all
Just
these wonderful things.
A cocktail of wonderful ingredients.
And minerals, trace minerals that are chelated with amino acids. So we have a wonderful means of improving our microcirculation. And the other thing that is exciting is there is some research into the spike protein of COVID, which is generated through the vaccination. And that spike protein being produced is a cation, which means if you look at it in its pharmacokinetics, it's a positively charged protein that is made. And that is chelatable by the anion of EDTA chelation.
Interesting.
Yeah, so if the negative EDTA infusion sees a positive spike protein, it's going to pull it out. And so that is something very promising. We need more research on it, of course, but that's a very exciting extra feature, and something that you might want to consider doing, especially if you're concerned about spike protein in you.
Well, great. I hope these changes all made sense to you. And really the only takeaway is we're just going to ask you to please honor the doctor's orders and the nurse's instructions not to speed up that IV. We're gonna make it run a little bit longer. We know that you're used to getting your IV in an hour, but until we can get the calcium disodium EDTA back in, we'll have to go with the 90-minute drip time. And of course, if you have any other questions, we'll encourage you to ask those at your next doctor's appointment. Anything else?
I don't think so.
All right. Well, I hope this has been helpful, and we look forward to seeing you soon. Thank you.